all. This is Dr. Mobeen Sayed with one more show. Today, once again, we have a rock star with us, Dr. Josh Helman. Dr. Josh, welcome.
Thanks, Dr. Bean. It's always a pleasure to be here with you.
Excellent. And I think our last video together that is on your channel, that took off very well, right?
Yes, over 110,000 uh, views and over 1,000 comments. So I love how interactive your community is. It's really cool.
That is amazing. And I love your channel as well. So if somebody wants to find your channel, how do they reach out to you? What
Yeah,
do they
so
search?
it's very easy. Probably the easiest way is just to go to Dr. Josh, drjosh.com/podcast. And there you'll
Perfect.
find dozens of episodes,
Perfect.
including ours together. So
Perfect. Awesome. So the topic today, this is nowadays quite near and dear to my heart, and that is the blood-brain barrier, its permeability. I've been doing some lectures about this as well. The reason I feel that this is an important topic at this time is that I think, and this is my opinion, not a scientific data point, I think after long COVID and vaccine side effects, there has been an increase in uptick in the neurological issues. Uh, do you feel that as well?
I do, but just to be clear, having worked in a dementia type clinic with Lyme and mold and other neurologic disorders, most of my patients, and this is pre-COVID, had a leaky blood-brain barrier. So I don't
Understood.
think it's new since COVID. I think it's just more common because most people have been exposed to the spike protein either through vaccine or through the virus.
That makes sense. So let's start. How about what is blood-brain barrier? What is its importance?
Yeah, so it's actually really important. So there, as humans, and there are other animals, but as humans, we're designed to protect the brain, and the brain has many protections. One is obviously the skull, a nice bony structure to protect the brain from trauma, but then also from within, you don't want toxins and infections to get into the brain through the bloodstream. So that's why the body has, as part of it, this barrier, this um, wall between the normal bloodstream and the brain. And the brain is a very vascular organ. If you didn't have this barrier, it would be in jeopardy from both toxins and infections.
Understood. So you're saying that in the body, in our circulation, there could be things in the blood that we want the brain to be protected from them,
A
right? So
hundred
the body
percent,
could be exposed to
right?
them, but not the brain.
Right, because the brain is such a delicate organ and it's very metabolically active, and it gets a lot of blood flow. So you can imagine if you didn't have some type of protection, that these infections and toxins could wreak havoc within the brain.
Understood. So now tell me this. How does blood-brain barrier become compromised? What happens? What are the factors?
Yeah. So there are many different ways this can happen. One is there you can get destruction of the endothelium, and that can actually happen in many ways, including damage from, of all things, this is really crazy, your own red blood cells. So
Oh, wow.
normally your red blood cells are nice and smooth and biconcave. But unfortunately, if you're exposed to oxidants, um, if you're exposed to what's called LPS, the bacterial cell wall, that can actually cause changes in the nice, smooth, biconcave red blood cells and give them spikes. And the problem is there are capillaries that are really small that these red blood cells have to go through. And when it goes through the capillaries, it actually does damage. These spikes, which might be 6 microns in size, will do damage in some of these narrow capillaries that are, say, just 3 microns, and that's what's happening, and that's what's kind of scary is you can actually have damage to your blood-brain barrier within just 30 minutes.
Oh, wow. So with how number one, how do we figure out if we may have a problem with our blood-brain barrier? And number two, I would love to hear what are some solutions that we can do.
Sure. So there are many different ways to assess the integrity of your blood-brain barrier. I'm not suggesting everyone watching or listening to this right now would go out and get these tests, but one test you can do is basically an MRI, a T1 weighted MRI using gadolinium, which is a heavy metal that's used as a contrast agent for an MRI. You can actually detect whether the blood-brain barrier is intact through the MRI.
Understood. So now imagine that somebody has brain fog and dementia is happening, or Alzheimer is progressing fast, or cognitive decline is happening, and they figure out that this may be blood-brain barrier. They go, they get tested. There is some verification or confirmation. We promised today to our audience that we'll talk about three things how to improve this. So tell us, how do we improve our blood-brain barrier? What is the first thing?
Yeah, so the first thing I would try would be anti-inflammatory agents, which would include things like oh,
Omega
what's a
3,
good example? Like turmeric, curcumin would be one.
curcumin, omega 3.
Omega threes are another a great way, and Um, and then I also like certain essential oils can help, including rosemary and frankincense essential
Hmm.
oils. And I normally, if I'm trying to reach the brain, I'll recommend people do that under the tongue if they're actually got pure oils and not petroleum.
Understood. And
Yeah.
on the omega 3 in the blood-brain barrier, if you allow me just for a quick second, that I wanted to discuss that as well. So for the audience here, the blood-brain barrier endothelial cells have a process which is called transcytosis, where they pick up things from the blood circulation and they kind of pinch it off and then take it through the cell towards the brain. And for that transcytosis, there is a protein called, I believe, MF2DR or MFD2R. That protein is responsible to pinch off omega 3 and kind of decorate the blood, the cell membrane with that, so that the transcytosis process is healthy. And if we have a lack of omega 3, especially in the blood brain barrier, the transcytosis process becomes unhealthy, and there is extra transcytosis that just lets things willy nilly cross from the circulation towards the brain. So, omega 3 is especially useful for the blood brain barrier. So, cool.
Exactly, especially when there's an inappropriate ratio. Most people unfortunately have way too much omega-6, which is inflammatory, and not enough of the omega-3.
Understood. So, curcumins, omega 3s, rosemary, that is one set of things, anti inflammatories. What else can we do?
So another one, and this may not strike people as like they want to do it, but it turns out that fasting, there's
Mhm.
something about fasting that helps reestablish the blood-brain barrier. And I think the way that happens is that when you're fasting, the amount of inflammation in your body goes down because when you're fasting, you're not putting food into your mouth. And I know this sounds really weird, but it turns out there's a huge connection between the gut and the brain. So specifically, if you're fasting, you will not have as many bacteria in your gut producing these inflammatory molecules, including LPS, the lipopolysaccharides, which can lead to the inflammation. So again, one strategy is to fast, whether you want to intermittent fast or do a juice or a water fast for several days. So I'm a big proponent. I worked in a fasting center for a few years, and I saw transformation of people with brain problems, dementias, other things get better if they were able to fast.
This is fascinating. So I know that fasting would also trigger autophagy, which would clear out some of the cellular debris as well and reduce the reactive oxygen species production because of the debris. My question to you: you brought up the fasting center. Do you see in within few weeks or months people actually with cognitive decline or Alzheimer's progression or dementia to start improving with the anti-inflammatories and fasting, for example?
I do. Yes, I definitely do see that. And again, one of the mechanisms is when you're fasting, you're basically resting your GI tract. Normally, the GI tract requires your stomach, etc., requires a lot of blood flow. If you're not eating, you're basically relaxing that whole area of your body, and then that blood flow can be shifted to your brain and other parts of the body to try to clean up. And then the other amazing thing is when you fast, it's not just when you fast, it's when you start refeeding. Your body innately understands, wow, it's time to start repairing. It did autophagy, it recycled and got rid of damaged proteins during the fasting process. But when you start refeeding, your body actually starts generating new stem cells, which then allow repair of many organs in your, I'm sorry, not organs, but parts of your brain, including the blood brain barrier.
That is very interesting. So you actually see your patients turning around or slowing down their progression towards dementia by fasting or anti-inflammatories.
I do, and specifically, if someone has an autoimmune condition, including dementia, etc., I'll be very careful on the diet. I recommend they refeed a low inflammatory diet that will hopefully be, will not include nightshades or other foods that will increase the inflammation.
Understood. So, for the audience who are joining us now, we have talked about three. We're going to talk about three things. So, we've already talked about two. One is the anti-inflammatories, curcumins, omega-3s, rosemary, and then the second is intermittent fasting or some other form of fasting. And I can vouch for that as well. That the fasting very quickly turns a patient's around, and not only just with the dementia or the cognitive declines, but also for other chronic inflammatory diseases that may be happening in the body, joint pains, fatigues, and cardiovascular things, and hypertension. So, very good. So, tell us the third thing.
So the third category I had in mind is to decrease what are called the MMP9 inflammatory proteins using things like I don't know, like sulforaphane,
Mm.
which you can get in broccoli or broccoli sprouts. So again, sulforaphane will decrease the MMP9 and can help reestablish the blood-brain barrier that way too.
So, tell me a little bit about the MMP9 and what is its role in the blood-brain barrier.
Yeah, so it's fascinating. Normally, the MMP9 um, helps keep inflammation at bay. It's a metalloprotease,
Mm.
and what's challenging about it is clinically I'll measure someone's MMP9 level, and if
Mm.
it's high, I know there's some chronic inflammatory process going on. But what's frustrating is it won't tell me where. It won't tell me it's in the blood-brain barrier, or maybe it could be in the liver, or it could be in someone's joint in the knee. So, but it turns out that the MMP9, if the levels are too high, that can lead to destruction of the blood-brain barrier, which is why I normally suggest people have include in their diet sulforaphanes in the form of broccoli or similar products.
That is fascinating. So, this is basically the talk for today. Do you have any bonus for us for today? We would. So, I think we did not introduce you in the beginning.
Right.
You are a physician, Harvard graduate, and you work with the Alzheimer patients, right?
I do. I do. I
So,
work to prevent and reverse Alzheimer's and other chronic neurological problems like Parkinson's or ALS. And
so uh,
yeah,
please tell us something more about the
sure.
brain health.
Sure. So another recommendation I have for improving, I'll give you two. Another recommendation I have is a supplement called modified citrus pectin or pectisol, and I like that because not only does modified citrus pectin remove heavy metals as a binder, it also decreases an inflammatory lectin that people produce. It's part of our immune system. It's called galectin-3. And it just turns out that there are clinical studies in people that you can actually decrease the amount of galectin-3. See, a lot of people who've listened have heard of there are lectins in plants, and there are, but it turns out that humans, we make our own lectins, specifically this galectin-3. And what can happen is in chronic conditions, including Alzheimer's, but many others, including brain conditions, you see way too high levels of this galectin-3. But the fact that I can take a supplement like modified citrus pectin and decrease my inflammation that way, I would say that's a strong bonus. And then my second bonus is, and actually this is kind of selfish as a physician trying to treat patients, it would actually make it so much easier for me to treat patients with a leaky blood-brain barrier with antibiotics or other intravenous medications, because I didn't have to worry that the blood-brain barrier was going to block it. So on the one hand, I love that healthy people have a healthy blood-brain barrier, but it definitely made it so much easier to treat patients. I didn't have to worry like, well, is this antibiotic or is this glutathione going to get up to the brain? I knew it would. So I think that second bonus is if you are having brain fog or other brain problems, just understand, find a physician like me who can help guide you through fixing it through that process.
Understood. So thank you so much. These are very important, 5 important tips. And I want to quickly show the audience your site as well. And I just went to that. Quick disclaimer, I have no strings attached. There is no financial strings attached. There is no commission. This is where drjosh.com. This is the site where Dr. Josh can be found. So drjosh.com. And Dr. Josh, can you tell me your main area of work and
Sure.
how this site can be useful?
Sure. So thank you for that. Yeah, basically my focus is reversing chronic conditions, including of the brain, Alzheimer's, dementia, and I have several clinics in South Florida doing that. But I also have a weekly podcast, drjosh.com/podcast, talking specifically about what you can do to prevent and reverse Alzheimer's. And again, as we mentioned, had an episode with you on the spike protein that very popular, 110,000 views. Yeah.
That is awesome. So if I went in here and I said drjosh.com/podcast, is it podcast?
Yeah.
Or
You found that. Yeah.
And then over here, there are your talks as well. Hopefully, I will be found somewhere over here as well.
You're probably a number 2.
Oh, come on, man. I should be number 1 somewhere.
Well, we're going to do a sequel to our episode together, but
excellent. So episode number 17, is the pandemic really over? Spike protein's long-term impact on brain health. Awesome. So with this, Dr. Josh, thank you so much for joining us. Thank you for enlightening our audience here. We'll figure out another topic again as well, and we'll continue to talk. Thank you so much.
That's awesome. Peace and plants. Thanks, Dr. Drbeen.
Thank you.
Bye-bye.